everyone for logging in to our Wellness Wednesday live webinar. This is a platform focused on health and wellness with guest speakers and specialists answering your questions about physical and mental well-being. My name is Zarmina and I'm delighted to be on this journey with you today. Today we're in conversation with Dr. Shirley Bang. Dr. Shirley is a Singapore Medical Council certified urologist, specialist in one of the few female urologists in Singapore. Her subspecialty interest is in the treatment of urinary incontinence, overactive bladder syndrome, neurogenic bladder, functional and reconstructive surgery of the urinary system. She also performs procedures for general urological conditions such as laser treatment for kidney stones and prostate conditions. Thank you so much for being here with us today, Dr. Shirley. Good evening, and how are you doing?
Good evening. I'm doing well. Happy to be here.
Thank you so much. Well, we're so excited to be in conversation with you. And of course, as one of the few and renowned female urologists, it's very exciting to be here today. And I'd love to start with ask you, what motivated you towards this specialty, being one of the few specialists in this area?
Well, I think first of all is I prefer surgery than medicine. So it has to be one of the few surgical specialty that I was going to join. So I was actually doing general surgery as my basic training. So I wanted to go into general surgery. And then when I was doing a posting in urology, then I started to, have interest in urological conditions like stones and urinary urological cancers and all that. And there's a lot of new intervention that's coming out in the field of urology at that point in time. And also very, very few female trainees. And that prompted me to join in the urology training. And then of course, at the same time, there was a opening as well. So that's how I started my urology journey.
That's really exciting. So can you share with us what kind of conditions do you treat? I know I mentioned a few, but it'd be lovely to hear from you.
Okay, so I think first of all, I see all general urological cases, which is the same for all of us. So we do see bread and butter urological cases like stone and some of the common urological cancers. Then each of us subspecialize into the field that interests us. So for me would be urinary incontinence, female urology, reconstructive urology surgery, basically. Yeah.
Okay, wonderful. Thank you for sharing that with us. And going into the topic of the day, urinary tract infections. What is a UTI? Can you explain that to us?
What is a
UTI?
Okay, yeah. So UTI is a short form for urinary tract infection. Basically, it's infection of any parts of the urinary tract. So for us, we generally divide it into the lower urinary tract, which is the urethra and the bladder, and then the upper urinary tract, which is the ureter and the kidneys. So in general, the lower urinary tract infections are much more common, especially in females, and then maybe later on we'll explain why, compared to the upper tract urinary tract infection. And then majority of the time, the cause of the infection would be bacterial infection. Yes.
Okay, I see. And what are some of the causes of this? And do factors like diabetes or menopause affect
Yes.
the frequency of UTIs?
Okay, so when we talk about UTIs, we divide it into the uncomplicated UTI versus the complicated UTIs. So uncomplicated UTIs would include patients without any urological problems. They don't have anatomical problems. So their kidneys are functioning well. They're able to pee. They're able to store urine just like you and me. And, we do get the occasional urinary tract infections, some a bit more frequent than the others. And then there are this group of patients with complicated urinary tract infections, which include the people you're talking about with diabetes, when their immune system is down, or in patients with anatomical abnormalities, like maybe kidney stones or urine reflux, or patients with neurogenic problem like post-stroke patients or paralyzed where they cannot store urine, they cannot pass urine well, and then you get this kind of infections.
Okay, I see. And so what are the complications associated with the UTI? And I guess I guess that also depends, like you said, the uncomplicated and the complicated cases, right? I suppose it's a very
Yes,
different.
yes,
If we
yeah,
can start with maybe the uncomplicated and then dig
yeah.
a little deeper.
Okay. The uncomplicated UTIs would be the general UTIs that we're talking about that happens in the community, especially in women. So the infections generally starts from the lower urinary tract, which is the urethra, and then the bladder. So then they will feel, the general painful when you pass urine. Sometimes you have blood, sometimes you have painful in the lower abdomen. So if they ignore the symptoms or they drag it a bit longer before they see a doctor, the infection travel up from the urethra, it travels to the kidney, and then it becomes the upper urinary tract infection. And then they will become sicker, they will develop fever, they have back pain, and then most of the time they'll need to be admitted to the hospital for intravenous antibiotics. Yeah. Of course, if we are talking about recurrence of this kind of urinary tract infection, it can cause formation of stone in the long term.
So this is a side effect of uncomplicated. Is it the same for complicated cases if you have diabetes, for example, if you're going through menopause, or are there other than complications to be aware about?
So for the complicated UTI patients, they generally progress quicker. Their symptoms actually progresses faster. That means when they develop some urinary symptoms, they already have fever or they generally become sicker. And also some of them may not even feel anything. And then the next thing is they started to develop fever or very bad symptoms like pain or blood in the urine. Yeah, that's how we divided it, yes.
Okay, so you touched upon such an important point of, not avoiding it or delaying seeking treatment. So when
Yes.
is the right time to seek treatment? And when is the right time to decide, oh, it's just, it's just a little discomfort, but should I do anything or should I just see how it goes? How do you make that decision?
I think in my experience, because I see so many females with infection, we kind of know if UTI is coming, right? Compared to just the normal, discomfort when we pass urine. I would say within 24 hours. Yeah, so if you start to feel a little bit of discomfort, maybe, yes, you can drink some water and then you can observe a little bit and then observe the next urination. And if the discomfort is persistent, and then usually at the end of the stream, you'll feel some tingling or pain, I think then you should seek help. You should take antibiotics already. Yeah.
And does it always end up in a severe case if you ignore it, or are there times that it can just solve itself,
Very, very few of them actually solve itself. I do know that there's some women when they start to feel the discomfort, they drink a lot of water. They would go to the pharmacy and buy some sachet to, the urine alkalinizer, and then the symptoms go away. I do hear about that, but they are very, very lucky. So if the symptoms don't go away in maybe 24 hours, you should seek help. Yeah.
Okay, 24 hours. So that's a very short window that you're
Correct.
to be proactive about it rather than delay it.
Yes, yes.
And
Sometimes it's better, safer to be a bit more cautious rather than drag.
absolutely. And I think this is a good time to ask, and I know a lot of our viewers are probably wondering as well, what's the difference in a urologist and a gynecologist when it comes to women? And if you can just kind of touch upon that a little bit for us.
Okay, so the difference between urologists and gynecologists are very clear. So gynecologists basically look at the ovaries, the uterus, and the vagina, the female organs. And then for urologists, we look at the urethra and the bladder. And of course, we deal with the kidney stones and all that. But there is there's a gray zone between urologists and urogynecologists. Yeah. So urogynecologists, they do see urinary tract infection, they do see urinary incontinence as well. But they mainly focus on pelvic organ prolapse, where the urologists we are not very familiar with. Yeah. So we seldom see a pelvic organ prolapse in that sense.
Okay, interesting. And so I just wanted to kind of go back to where we were. What would you suggest are preventative steps that somebody can take to avoid a UTI? Because like you said, once you think you have symptoms, then it could be 24 hours and you want to seek that medical attention and not avoid it. So instead of reaching that stage, is there something that we can do to avoid it or prevent it somehow?
Okay, so for prevention of urinary tract infection, I always educate my patients. So you must know that there's a bladder and then there is a urinary tract. So the bladder has a self defense mechanism where it has to have a diluted urine and it has to pass out the urine regularly so that the bacteria will not multiply in the bladder. So with that, I always tell patients, number one, you must drink adequate fluid so that your urine is not too concentrated. When it's too concentrated, the bacteria is very in high levels and very concentrated. So then they can easily attach to the wall of the bladder and then thus causing infection. So that's number one. If you drink enough, hence you produce a lot of urine, you must pass out the urine regularly. It's a form of flushing. Is a kind of mechanisms that the bladder has to protect itself against infection. So every time when we pass urine, we pass out the bacteria that is inside the urine. And then number three, the hygiene. So we do not want bacteria from around the surrounding areas. For female, the urethra is just next to the vagina and then there's the anus. So we don't want to contaminate the urethra with bacteria from the vagina or the anus. So hygiene is also very important. After passing motion, you have to clean from the front to the back rather the other way around. And then it comes to the maintaining of the health of the whole vagina urethra area, which is mainly by some supplements that we may talk about later, which is by the good bacteria. Ironically, we do not advise patients to clean the area with soap and feminine wash because you're actually cleaning away the good bacteria.
Yeah, I was just about to ask about the douche and the pH
yes.
level. Can you tell us a little bit about, I feel like there's a common misconception around that. You have so many products targeted to women and these feminine products, and I guess they're not always very helpful.
Yes, that's right. So it's a general misconception because when you see these kind of products being sold in pharmacy and then they put labels like maintain your pH, maintain your hygiene and all that, it's generally not true because for female the pH in the area is usually maintained slightly acidic by the good bacteria, by the probiotics over there. So if you want to maintain the pH, we actually need to replenish the good bacteria rather than using the solution to clean them away. Yeah. So in general, we advise patients not to be too obsessive with the cleanliness at that area. Yeah.
Yeah. No, I think that's a very important reminder, and maybe for a lot of people, it's the first time
yes.
that they're hearing that. Dr. Shirley, can you share with us, as a physician of this area, what are some of the common treatments or procedures that one would undergo as part of having a UTI? What do they come into you for, and what do you sometimes recommend that can be helpful?
Okay, so for in general, if the woman has if you're talking about recurrent infection, that means 3 infections in a year or 2 in 6 months. I generally look at the women and depending on their risk factors, if the UTI frequency is a bit too often, I do some ultrasound or scan to look out for any anatomical abnormalities. Like any stone that's causing this recurrent infection. And I do offer cystoscopy or camera into the bladder for these women to make sure that there is no other kinds of cystitis or inflammation inside the bladder, which that requires a bit more help than antibiotics to resolve their symptoms. So I think in summary, it's basically a ultrasound or scan of the kidneys and the ureter, and then a cystoscopy to the bladder. That will complete the check of their urological system.
Okay. So does that mean, would you recommend a regular screening even if somebody doesn't have UTIs frequently or maybe not at all? Is there some kind of a screening they can undergo that they should, or is it not really necessary if you're not experiencing that too much?
We do offer screening urine analysis in general, but not for the sole purpose of urinary tract infection. So for over here, when they go for the general health screening, they always include a urine test. And the urine test is to identify any blood or any white cell in the urine. It's mainly to screen for cancer rather than urinary tract infections. So if you're talking about women without any symptoms, they can go for health screening mainly to look out for blood and to make sure that there's no cancer rather than infection itself.
Oh,
Yeah.
okay, great. So, Dr. Shirley, according to some sources, almost 50% of women will experience a UTI in their lifetime.
Yes.
So, you also mentioned a little earlier that this is more prevalent in women than in men.
Yes.
So,
Yes.
one, is it true that it's almost half of us that will experience this? And if so, why is it more common in women than men?
Okay. So it's more common in women because it's the way we are built. Our urinary tract is much shorter than a male, you can imagine. So
Mhm.
it's easier for bacterial colonization and to enter the bladder. Because for female urethra, it's only 4 centimeter. And for male urethra, you can see it's 10 centimeter. So it's not easy for bacteria to go in through the urethra and travel all the way to the bladder. Whereas for female, it's very easy. So I think that the main point is just the anatomical variation between female and a male.
And is the experience of a male UTI very different, or are there a lot of common factors in between the two?
The symptoms are quite common between the male and the female when they do experience urinary tract infection. That means painful, burning, the lower abdominal painful, or sometimes they do see blood. However, the difference between a man and a woman is that for men to have infection, it's not usually straightforward compared to female. So generally for men, if they do experience infection, we must find out if there is any anatomical blockage in their urinary tract. Because like I mentioned before, it's not easy for bacteria to travel all the way up and cause infection in the male. So if that happens to the male, we generally take it more seriously compared to the female. Of course, in the men, we must check the prostate, which is one of the most common causes.
Yes.
Yeah.
All right. That makes sense. So you suggested that within 24 hours or maybe after 24 hours you're seeking help. You go and meet your physician and follow the recommended what has been prescribed. So what is that recovery journey like? How long is that recovery time period? What are you experiencing in that? What can you expect?
Okay, so if you're talking about a straightforward female UTI, if you start to take the antibiotics, generally you recover quite fast. After 2 doses of antibiotics, you will feel much better. Your pee will feel much comfortable. Maybe if you do experience smell, the smell will be gone. However, if you don't experience a response in 48 hours, then you should go back to the doctor and ask him to do a urine test or urine culture, because sometimes the antibiotics may not be suitable. That means the bacteria is resistant against the antibiotics, and you may need to change to another course antibiotics. But if you're talking about straightforward cases, within 48 hours, you'll feel much better.
Okay.
Yeah.
So we can expect maybe a shorter recovery time for simpler cases.
Yes, yes.
And you mentioned, aside from the antibiotics, you mentioned some supplements.
Yes.
Is this a preventative approach or is it more a curative approach? And what are they? What do you recommend?
Okay, so we know that the main treatment for infection is to eradicate the bacteria. So which is the first step would be antibiotics. And then for some women with recurring infection, they need to take some supplement to prevent the next attack. Then usually the supplement will use to maintain the health of the vagina area or the pH of that area. So then we are talking about probiotics, then cranberry cyst, and some even suggest D-mannose. So for cranberry and D-mannose, how they work is that they prevent the bacteria, which is the E. coli, from attaching onto the bladder, the lining of the bladder, so that, you know, when the person passes urine, the bacteria can be flushed out.
Okay.
Yeah, so these are the three main supplements that we will advise the patient.
Okay, that's very helpful. I think all of us can take some notes from that and go to the pharmacy after this session. That's very helpful. Dr. Shirley, before we open up the floor to audience questions, I just wanted to ask you, what are some of the common challenges you experience with your patients? You know, some common difficulties, maybe their reaction to treatment, or their adherence to the antibiotics. What are some of the common challenges that you see?
Okay, so I still see a small group of women with recurring infection. No matter what they do, you know, they have good hygiene, they have good voiding habits, you know, but they still keep getting this kind of recurring UTI attack. It's very, very difficult in this group of women, and some of them have to go on to long-term low-dose prevention antibiotics. Yeah, usually we do it for maybe 3 months, 6 months, and some of them, once they stop the antibiotics, the UTI attacks actually come back. It's very, very frustrating for the patient, as well as, you know, for the treating doctor, because no matter what you do, you just cannot cut down the numbers of UTIs. Some women are just generally like that. So these are the challenges that I face, you know, from day to day.
Great, thank you. Well, let's jump right into questions from our viewers. So we actually have 2 questions from one viewer that I will read out to you.
Okay.
Dr. Shirley, is it normal to get UTI so frequently every month, for example, usually after intercourse? I don't have diabetes and I'm only 30 years old. And this is followed by whenever I have symptoms, very visible ones, I treat it with alkalizer and cranberries, and somehow it goes away, but the frequency of it concerns me.
Yeah. So what she's experienced is very, very, very common. Actually, I would say that 80-90% of premenopausal women getting recurrence UTI is usually post-sexual intercourse.
Okay.
Yeah. And of course, it is higher in unprotected sex, frequent sex, or a new partner. And of course, if there is already a risk of STD, then there's a higher risk of UTI as well. So she's asking whether it is normal to get such frequent attack. It's not normal, but it is very, very common. That's why it's very frustrating for these women. And some of them even avoid sexual intercourse altogether. I think some ladies, they are, the pH in their area, it's not, the balance is very fragile, I would say. It's very easily disturbed. That means by sexual intercourse and all that. Then they will develop these symptoms, the discomfort, the burning, and usually, I would say 24 to 48 hours after sexual intercourse, they will start to have symptoms, because that's when the bacteria colonization actually happens. So if they're lucky, if they take the urine alkalinizer and cranberry, or some even take probiotics and the symptoms go away, I think that's okay. But if the symptoms do not go away in, like I said, 24 hours, then they should start some antibiotics. And then after that, we'll tell patients some of the proper hygiene. We always say you try to pass urine before and after sex. And after sex, you may wash the area with some warm water. And then, you know, that's all we can tell them. And if it keeps happening, then some of them may even have to go on to self-start prevention antibiotics. That means after sex, they just take 1 dose of antibiotics to prevent the full-blown UTI.
Okay. And so I guess you'd recommend that maybe in this case, because of the frequency of it, so maybe every month is quite frequent, I would guess. Right, that's quite frequent.
Quite frequent, yes.
Absolutely. No, that's very helpful. So let's take another question. This is an interesting one. Can we talk about UTIs transferred from men and how to prevent them? So is there anything also, I guess, that we can recommend to men as well in order to protect both parties?
Okay, so interestingly, I do get this question being asked quite often, and then the couple usually come to the clinic. If you're talking about a general bacteria infection or UTI, it doesn't spread from the men to the women.
Okay.
Yeah, it doesn't come from the men's urinary tract that goes into the women. It's because of the sexual intercourse act itself that disrupt the pH of the female, and hence the female develop the UTI. The only bacteria or diseases that can spread between men and women during sexual intercourse are STDs or sexually transmitted diseases. Then these are very different bacteria altogether, like chlamydia, gonorrhea, ureaplasma, and all that. If it's positive for those, then of course we have to treat it accordingly.
Yeah. Okay, great. We have a next question, which I think perhaps a few of our viewers might be wondering. So it's a great question. What is bladder training? Can you share a little bit on what that means? I think we can guess what that means. Tell
Yeah.
us in technical terms.
Okay. Bladder training is a very general, it's a very broad term, but usually we use bladder training in patients with maybe overreactive bladder. Overreactive bladder meaning that they pee very frequently, they feel the urgency very frequently, and they pee small amount each time. Then we will teach this patient how to retrain the bladder. So we'll try to ask them to hold a little bit longer each time. That means to prolong the interval. So when they have the urgency, they can do distraction method, they can do deep breathing, they can sit down until the sensation actually dies down. And then they'll wait for the next wave of sensation comes, and then to see whether they can actually distract themselves again. So they drag this interval longer and longer to distend the bladder, to help the bladder retrain back, the sensation, so that it's not so sensitive again. Yeah, so it works in some patients, but in some real pathological overreactive bladder patients, bladder training may not work so well. Yeah, but I mean that's what bladder training means.
So in which scenarios would one be recommended to do bladder training? Why is it required?
Okay, so there's a difference between bladder training and pelvic floor training. Yeah, so pelvic floor training, it's when the women actually experiences incontinence or leak, after they deliver or maybe postmenopausal when the pelvic floor muscle is weak. So that's pelvic floor exercise. Bladder training itself is in conditions where the patients have overreactive bladder. That means they go very, very frequently. And sometimes it's because of anxiety, or maybe, when they see a clean toilet and then they want to go and empty the bladder. So sometimes it's a psychological. Then we'll teach these patients how to retrain the bladder so that the urgency will not come so often. So that's the meaning of bladder training.
Okay, well, that's a great point. You mentioned about the psychological factor, because our next question is asking, what is the relationship between stress and urinary incontinence? So I guess that ties in a little bit with about what you were just saying as well.
Okay, so the stress is psychological stress, or stress as in stressing the bladder, like coughing, exercise, that kind of stress.
They mentioned anxiety and stress, so I think probably psychological in this case.
Psychological, yeah. So I think it's very similar to our intestine. So sometimes when we are anxious and we are stressed, we feel like there's the term used, a butterfly in the stomach. So it's a similar thing. When we are anxious, when we're stressed, we generally are more hypersensitive. So we feel the urgency of the bladder. And then it makes us want to go to the toilet to empty the bladder. But it doesn't mean that the bladder is ready for contraction. Yeah.
Okay.
So the control of the bladder comes from 2 points. One is psychological. So our higher center can actually ask the bladder to contract, and the spine. So when the bladder is not ready, but if we want the bladder to contract, i.e. we want to pass urine, we can actually tell the bladder to do that. But in some patients with stress or anxiety, they are telling the bladder to contract a little bit too often. And then after a while, it becomes a habit. And then the frequency of the urination will start to disrupt their life. Yeah, so that's how stress actually can affect the bladder.
Okay, and you mentioned physical stress. Could you touch upon that a little bit? Like you mentioned coughing, sneezing, and maybe some other actions?
Okay, so when we are talking about stress down to the bladder, it's when we exert stress to the bladder, like when we are sneezing, coughing, jumping, exercising. By right, when we do that, the pelvic floor muscle or the sphincter of the bladder is able to close the urethra so that we don't experience urinary incontinence. But in some conditions where the muscle is weak or when the sphincter is compromised, then when we're coughing and sneezing, it's unable to close, it's loose. So then we experience incontinence. Yeah.
Okay. We have a next question, which is a great one. Other than immediate discomfort, what are the risk factors long-term of frequent UTIs? I think we've touched upon this a little bit, but it'll be great if you can summarize this question.
Okay, so if you're talking about recurrence UTI, but each time you treat it properly, theoretically, there is no long-term risk. I know some patients, they are very, very worried about kidney failure in the end, because of this recurrence of infection, whether it will affect the kidney, eventually the kidney dies and all that. But if each time you treat it properly and it completely resolves the symptoms, it should not cause any long-term complications to your kidneys. Yeah. Okay. If you're talking about recurring infection and each time it's not treated properly, it goes up to the kidney or maybe there's underlying reflux problems, yes, the long-term effect would be damage to the kidneys.
Damage to the kidney. Is that very common to see that in patients, or is it very rare to see damage to kidneys?
No, it's actually quite rare. It's quite rare. For the general common female UTI, it's not common to have damage to the kidney eventually, you know. Yeah, because we have this so often that each time you just treat it properly, it should not cause any problem.
Okay, great. We have a next very specific question, particularly on pregnancy.
Yes.
So can you share a little bit about UTIs around pregnancy? Is it more common, less common? Could the symptoms be mistaken for something else around that time?
You mean when the woman gets pregnant?
Yeah.
Okay, so because urinary tract infection symptoms are quite specific, you know, painful, burning, blood, and all that. So if during pregnancy, if you experience these symptoms, very, very importantly, you have to get treated because, you know, because of the pregnancy, you may induce preterm labor and all that. Yes, it can be mistaken as other things such as stone. You can also have this kind of symptoms. And also as the pregnancy progresses, especially going to the second trimester, when the uterus start to press on the bladder, the woman may experience increase in frequency. That means they go to the toilet very often and they pass out very little urine. As long as it's not painful, you know, there's no smell, no discomfort, I think it's okay. You can just observe.
Okay, and the treatment course for somebody pregnant with a UTI would be the same?
Yes, it will be the same. But the choices of antibiotics, we need to be very careful that it will not harm the baby. Yeah.
Right. Okay. So our next question is particularly about diabetes. This individual is asking if I'm diagnosed with diabetes, is there any pre-screening that I can undertake to know my risk of UTIs?
Okay. So for diabetic patients, sometimes they do not experience symptoms, or, you know, by the time they experience symptoms, it's actually quite severe. So if he has concerns, he can actually do a simple urine dipstick. You can just do it at the outpatient clinic, or of course you can send your urine to the lab for a proper test. But if you want a quick one, you can just do a urine dipstick to look at the white blood cell in the urine. And also another parameters that we look at would be the nitrite. If the nitrite is positive, then it's quite, I mean, it's more or less it's a UTI. But I would do advise diabetic patients to look at the color of the urine and the smell. Even if they don't experience symptoms, if the color of the urine starts to become cloudy, a lot of white sediments floating inside, or it starts to have this ammonium kind of smell, then you should get it checked.
Okay, so looking at the health of it and if it looks regular or normal.
Yes, yes.
Absolutely. Our next question is actually, I believe, in relation to something you mentioned earlier, and this is about holding in your urine or restricting your bladder. So,
Yes,
this viewer is asking that a lot of times I delay relieving myself because I'm busy or occupied. Is it really
yes.
as serious as I think?
Okay, so this is very, very common thing for female to do. I mean, I assume the person is a female because
I
for female, we are very good in holding our bladder, especially when we are busy and occupied. Um, if you do it a few times, I think if you're lucky, you can get away with it. But if you do it regularly, all the time, it does increase the risk of getting an infection. Yeah,
Okay.
and that's one thing. Another thing is that if you hold it regularly, when you're older, when you're in your 40s or 50s, you will start to experience what we call a weakness in the bladder wall. That means your bladder has been distended for so long when you're younger. And then when you're older, the wall starts to lose its function or becomes weak. Then you will experience things like, you go a bit more often, you can't hold it in, or when you pee, the stream of the urine is not fast anymore. So I think to avoid that, when you're younger, just try to pee regularly, no matter how occupied you are. Yeah.
Absolutely. Great advice. We have a next question, a simple one, but a great question. How can I know if my pH levels are safe and normal? Is there some kind of a test that one can purchase or take online? How does that work?
If you just want to know the pH of your urine, you can just buy the dipstick.
Okay.
I'm not sure whether the pharmacy sell. You can just buy a bottle of urine dipstick and then just dipstick, and then you look at the indicator. That would be a very quick and simple way to know your pH.
Okay, that's interesting. What
Yeah.
else is this? What is the purpose of this dipstick? It's actually the first time I'm hearing about this. It's interesting.
These dipsticks are usually used by a general practitioner at the outpatient clinic where they need to know some of the common parameters of the urine quickly, such as, like I mentioned, the red blood cell, the white blood cell, the nitrite, sometimes glucose as well, or the pH. Some patients do purchase it from the pharmacy and put at home, especially those with recurrent infection and they want to know whether it's infection or not. Then they just buy one bottle and then they do the dipstick themselves at home. Yeah.
Okay.
So that's the main purpose of dipstick. It's mainly for the GPs.
All right, all right.
Yeah.
We have another question going back related a bit to pregnancy. Can a UTI cause a false ovulation test? I guess they're referring to the ovulation stick. Is there any correlation between having a UTI and an ovulation test?
I don't think so, I don't think there is a correlation between UTI and the ovulation stick. Yeah, I don't think so.
All right. And another question, a very simple one, but probably one that a lot of people are wondering, is
Yes.
what is the difference in a yeast infection and a UTI? Both
Okay.
very common, I guess.
Yes, yes. So both comes hand in hand. Okay, so for yeast infection for female, it's very, very common. And whenever a woman has yeast infection, it means that the pH in the area is disrupted. That's why it's common for women to have yeast before menses, around the time of ovulation, or when they're suffering from UTI, they start to have some yeast infection. So yeast infection is a candida or fungus infection of the vagina area. It's an indication where the woman is under stress, or indication of imbalance between the good bacteria and the bad bacteria. Yeah, and it also happens when the woman is taking antibiotics for whatever reason. It could be UTI, it could be sore throat. So if the woman is taking antibiotics kill everything. So they will kill the good bacteria as well. Then they'll start to have yeast infection.
Okay.
So urinary tract infection is the infection of the urinary tract itself. So it's a little bit different from yeast infection. Of course, yeast can affect urinary tract as well. But one is a fungus and one is a bacteria.
Okay. Another question which actually was on my mind, so I'm glad that
Yes.
somebody asked it. Are UTIs age related? So I guess, the older you get, can you expect to have more UTIs, or is it there's no correlation?
Oh, absolutely. So definitely age related. I'm speaking from my own experience. So okay, so in general, the younger ladies, the younger ladies that we are talking about without sexual intercourse, usually the cause of the UTI would be because of their avoiding habit. That means they don't drink enough, or they hold their bladder, especially in some occupation like air stewardess, nurses, doctors, teachers. They don't have time to go toilet, so they always get infection. But it's not very frequent. It's only when they hold their bladder. And then as these women grow older, and then they enter into the adult life, where they get married, and then they'll start to have sexual intercourse related UTI. Of course, you can still have the voiding habits problem. And then when they're reaching in their late 30s or 40s, they may experience perimenopausal changes. Yeah, so they'll start to experience some imbalance in the pH, some dryness in the vagina, some irregular menses, and then they'll get UTI a bit more frequent during that period of time.
Okay.
And then when they reach postmenopausal, when there's complete, dryness at the area, they get hot flushes and all that, then, the attack of UTI becomes even more frequent. Yeah, so
Okay.
it's like a progression. No?
Okay, so it becomes more, I guess, likely post-menopause. So that's something that
Yes.
menopausal women will have to be aware.
That's right. It's easier to get UTI postmenopausal.
Okay, interesting. And also going back to another point you've mentioned on the session about cranberry. So
Yes.
it seems like some of our viewers are also mentioning that they take cranberry, I guess supplements, and you've also recommended it. Is that
Yes.
a preventative, or is it a cure? And is it just for women, or should men also be taking that?
It's generally for women, because for men, I guess no harm if the man takes it, but the cause of UTI for men is more of, like I mentioned, it's anatomical problems. So it's rather, we need to go and find out the problems rather than asking the men to take cranberry. But for women, most of the time for us, it's not anatomical problems. It's because of the colonization of bacteria. And therefore, we take cranberry to prevent the colonization of the bacteria. So it's more like a preventative measure rather than curative.
Okay, well, that's great advice. Thank you for that, Dr. Shirley. I'd love to ask you for a closing message or some tips or any message you'd like to share with our viewers for the day before we close out the session.
Okay. I think ever since I came up to the private practice, 80-90% of my patients are actually female. I do male, and I started to understand the frustrations of these women when they are having a recurrent UTI, because like you mentioned, that 50% of female will have UTI in their lifetime, and UTI it's not a very pleasant experience for the female. It actually affects the life, affects the work. Although on the outside it looks normal, but inside, it's suffering. So I understand the suffering that these women are going through. So it's always a journey of the patients as well as for myself. Two of us will have to go this journey together. And some recurrent UTI women, they get very frustrated. They want to give up and all that. So I just want to tell these women that psychologically, when we are positive, when we're happy, the attack of UTI actually goes down. So you must remember that fact as well. So do not be frustrated easily. Do not give up. You just have to be very positive and treat it as it comes, and trust your doctor, trust your physician, and then you will notice that the attack actually goes down. compared to somebody who is always, negative, moody, and sad, and all that, and stressed, and then you'll get more attack. That's what I find. That's the soft point of this kind of condition.
Absolutely.
Yeah.
That's such a wonderful reminder and a great message to close with. I think it reminds us all, to be aware of our health, but also to be positive and avoid
Yes,
unnecessary
yes.
stress where possible. So I would again like to thank you so much, Dr. Shirley, for being here with us. It was such a pleasure. And I think our viewers really gained a lot of insights and a lot of information from hearing you speak today. So thank you for being with us.
Thank you. Thank you so much for having me.
Absolutely. And also thank you to everyone else who joined this session, who submitted their questions, who logged in to watch this conversation with Dr. Shirley. And thank you again, Dr. Shirley. We hope you all gained some interesting insight from today's discussion. If you'd like to see more of these videos, please check out and subscribe to our YouTube channel. Thank you, everyone. Have a great evening. Thank you, Dr. Shirley.
Thank you so much. Bye.
Bye. Thank you.